Good evening, folks, and welcome to the Safe Ed for All show on Socialist Telly, episode 10 now, my goodness. Tonight I am joined by Safe Ed regulars Sarah and Nikki, and our special guests today are Dr. Stephen Griffin, Associate Professor and Virologist at the University of Leeds and a guest member of Independent Sage, and Dr. Barrett Pankania, I hope I'm saying that right, lecturer at University of Exeter Medical School and a chap with over 20 years of experience in communicable disease control and infectious disease management. Huge welcome to you all. Thank you so much for your time tonight, doctors. I appreciate how busy you both are. It's very much appreciated. How is everyone tonight?
Oh, good.
Yeah, not too bad. Busy.
Good. Always a good start because the conversation generally goes downhill from there with what we tend to discuss on these shows. But we invariably start with an update on the work of Safe Ed for All over the past week. So Sarah and Nikki, what have you been up to over the last 7 days?
Okay, I think I've got more or less everything. I just flashed it by Nikki earlier. So if I miss anything, Nikki, jump in and tell me.
Yeah.
So let's start from the top. Our letter to Ofsted that we sent, just asking for some clarification. If you remember the interview we did on Times Radio where Niamh Sweeney suggested that some of the pressure on schools as to why they're not putting in place mitigations was due to Ofsted and Ofsted directing teachers and schools to stick to the guidance only. We asked them for some clarification on this, and we've had a response to say they've received our letter. Their communications officer will respond to us soon. Okay, so we're getting somewhere. At least we know they've got it, and at least they are going to reply to us, so that's something. Today I had a reply from Vicky Ford to our letter that was sent on the 9th of August, asking for her to urgently look at the reopening of schools. Her letter to me today says, thanks very much, but I'm not in this job anymore. Contact Will Quince, who's the Minister for Children and Families. Obviously, I've sent a very polite reply back saying, well, let's hope Will Quince will reply in a quicker time frame than you did yourself.
Much like
so
hard work for her to pass it over to him while she's there. I mean, they're in the same party, for heaven's sake.
Well, yeah, you know, something that's taken 9th of August before schools reopened, we wrote and we asked for certain things. Can they look into it, and would they prioritize mitigations to prevent what happened last year, which has happened again this year? And she couldn't be bothered to reply. Anyway, I'll try and stay nice about her for now. We're supporting the school strike that is happening every Friday. We realise that not everybody can strike or withhold attendance for a day. It's not very popular for some people. They don't feel that they want their children to miss out on some further education. However, anyone who can't withhold attendance, they can still support. So they can put a supportive message. They can retweet those supportive messages. You know, remember there are some families who have had to withhold attendance since last year because schools are not safe enough for their family members. So this is just a little bit of solidarity and remembering that some people haven't had the choice. They have had to keep their children home because schools are not safe. We're supporting the Hive Vigil, which is at 8 p.m. every Thursday, which Nikki started with the Hive, to remember all of those under 18s that have sadly passed away in the UK since the pandemic began, which we're now on, unfortunately, 110. There was another reported today. The reporting is a little bit hit and miss in terms of timeframes because it takes time for deaths to be registered. It takes time for autopsies and everything else to be done. So the ONS data, sometimes it can be a death that happened maybe 6 weeks ago that then appears on the data. But luckily there are people looking at that and keeping on top of it, and we want to remember them. You know, that's not neglecting all of those other people who have sadly lost their lives to COVID in the UK. This is just something that, as Safe Ed and the Hive, we're trying to remember those that are under 18s. We had some support this week from Dr. Amir Khan. I don't know if anyone noticed that on Twitter. He went on the Lorraine show and talked about mitigations. I think it's the first time I've heard anybody in the mainstream media who has said that it's not okay to unnecessarily and knowingly expose children to an increased risk of infection. So That was very positive.
And he actually said for the first time ever that we shouldn't be saying it's okay because they had an underlying condition. And it was like, first time ever. It was just amazing to hear that.
Yeah, to hear somebody call out the ableist rhetoric that we keep hearing. Oh yeah, but those who have died, they had something wrong with them anyway. It's horrendous to the rest of us, but it was the first time to hear that from somebody on mainstream media, so it was very, very good. We're still pursuing answers from the DfE on their decision to remove masks last May. Remember, they wrote to us and said that it was not in the public interest. They do have the report that their decision was based on. They wouldn't release it because they felt it's not in the public interest. It was exempt under Article 35 or something because it's formulation of government policy. I went back to the lawyers, I asked them, their advice was no, that's been misapplied. Formulation of government policy, yes, but this isn't formulation. The policy has been formed and it has been acted upon. Therefore, now there's nothing to stop you releasing the information it was based on. They've still not replied to me. So I send a weekly, by the way, I'm still here. I'm still waiting for a reply from you. I've not had a reply again this week. And then one worrying thing I'd like to bring up is that this week, you may have seen that Robert Halfon proposed a bill which was to prevent schools from closing without having a triple lock put in place. I don't understand all the details. I won't go into all the details of what that would involve, but it would basically prevent a school from deciding that they need to close, not just for COVID, but for other matters too. And if a school needs to close, it's usually because there's an emergency situation or something drastic has happened and time is of the essence. So he proposed this bill. This bill was then all over Facebook, Twitter by Us For Them, saying they've worked strongly. They've got Robert Halfon to propose their bill, which they have been working with him on. We all know what our worries are about Us For Them, the UFT. I won't call them what I actually call them. And I was surprised that it was supported by Munira Wilson from the Liberal Democrats. Munira sat in the APPG coronavirus sessions, and she's heard the evidence from witnesses of what lack of mitigations in schools has been doing to people. She's heard all of that, and then she supported this bill proposed by Us For Them, supported by Robert Halfon. She came out and said no, she was not a supporter of Us For Them. She was a supporter, wait for this, for September for Schools. Us For Them, September for Schools. So we started doing a little bit of digging. We look at the rhetoric of September for Schools. At no point do they mention mitigation. At no point they talk about protecting children from unnecessary infections. The rhetoric is exactly the same as Us For Them, slightly dumbed down, focusing on the harms of school closure and the harms of remote education. Not going as far as Us For Them do by stating they don't want masks and they don't want testing and they don't want vaccines. However, it's just Us For Them watered down slightly to appeal to other parties, I think. We're doing some further digging. We know who is registered with the domain. We know who started it. We know who's proposed some of the parliamentary papers that have been submitted from September for Schools. So Us For Them, September for Schools, we think you're very similar and we'll find out. And I think that's about it, I think.
Yeah.
Excellent. Thank you for that roundup. Us For Them style policy being made by the Conservatives, being pushed by Robert Halfon, a chap with a disability himself. So for anybody who's vulnerable, particularly, or at risk of catching stuff or becoming ill, or at higher risk of becoming ill in some way or another, you would think he would be the sort of person that would know a little bit better, but he's a Conservative, I must remind myself. So I don't
We just suggest to people, if they've got a couple of minutes, go along and watch the meeting last week that was with Nadeem Zahawi, and I think you'd be quite shocked by some of the things that they discussed as an education committee. So if you've got the spare hour, do that.
I think I'll look into that, certainly. I'm just wondering what the two doctors might make of, with considering all the mitigations that have been removed from schools and knowing what they do about virology far beyond our understanding of it. Hopefully they can shed some light on the effect that this triple lock on schools to stop them shutting in the middle of a pandemic, for example. Let's just keep on that theme. Stephen Barrett, what do you think of this sort of a plan by the government?
Well, as I understand it, those sorts of measures are usually withheld for sort of essential infrastructure like power stations and things like that. So I really don't see how you can list schools under that sort of criteria. It sounds like it's a bit of a, I wouldn't say underhand, but an indirect way of getting what they want. And I sincerely hope it doesn't come through, because you need to have flexibility. And we've already had public health teams intervening in different schools around the country. It shouldn't really be DfE's remit to impose things if the public health people want to do something else. So that would be my take on it. I think it's misguided, and it clearly has an agenda, and I sincerely hope it doesn't come through.
Seems to be the agenda is just to keep the schools open, whatever comes. I'm gonna come on to some questioning along those lines. Actually,
if I can add.
Oh, sorry, Barrett. Can you please come
on? So I operate as a infectious disease expert, outbreak management. That's what I do, and I deal with schools, nursing homes, etc. And I'm finding increasingly the range of control measures that I can deploy to reduce, control infections in schools is limited by law or limited by regulations. And as a result, on the one hand, I am the communicable disease control expert, but I cannot expertly conduct my expertise in reducing infections in schools, because my options have been limited by design. My options should never be limited by design. I shouldn't be stopped from putting in measures such as we have too many cases in this classroom. We need to put this classroom into quarantine. We need to bring in extra measures to test. We need to stop contacts of a case who may become a case themselves from coming into school and bringing in fresh infection. I want to at pace reduce infections. And one way to reduce infections is to immunize. And I have been prevented for a very long time from putting in what I would call ABC of infection control measures in schools.
Yeah. Thank you for that. It does actually lead in quite nicely to the first question I've got regarding vaccinations, because we're now at the point, as Sarah said a moment ago, where we've now seen 110 children pass away from COVID in this country. We know they are just as able to transmit this virus as anyone else. The JCVI, the Joint Committee on Vaccination and Immunization, as we discussed on last week's show, dragged their feet regarding vaccination. They didn't recommend it for children. The government overruled them in the end. But these are the scientists that are advising the government. And when the government tell us they're following the science, it's their science that they're following. What is your view of the JCVI and their advice? How is it tying your hands, or how has it been tying your hands? Is this group of scientists actually fit for purpose? With the ongoing statement that children are less vulnerable now, wearing thin in light of these fatalities. Well, can I come to you first, Barrett?
Okay. I'm very concerned. I have great respect for SAGE and JCVI and others, but during this pandemic, I have found that SAGE was not fit for purpose. And I regret to say that JCVI also falls into the same basket, not fit for purpose, on this decision that they made on children's immunization. I'm very disappointed. I do not know who is leaning on whom for them to come up with these decisions. So let's focus on JCVI first. They pontificated on a very narrow margin whether to immunize or not. And then they looked at modeling, and then they discounted the modeling. And then they finally came up with the answer, it is marginally beneficial only. They didn't look at the totality of the situation. They didn't look at consequences of infection and long COVID. They didn't look at consequences of infection and infection spread from that younger age group to older age group, and then the older age group get more severe disease and some of them will die. So actually, even though the little children in the schools are not going to get severe disease, it is a public health measure to immunize them like we do, like we have been doing for seasonal influenza for several years now. So for seasonal influenza, we know who gets more severe illness, the elderly. How do we stop the elderly from getting a lot of seasonal influenza viruses? We suppress it at the schools level, and it works very well. So what is suddenly new for them to say, I don't think it is that necessary to immunize in the schools setting? Furthermore, finally, before I stop, is we are out of step with other eminent countries with very good scientists, the United States, Canada, Israel, European Union. What's going on in the UK to be completely out of step with partner countries with whom we've worked with for decades? Something's afoot, and I don't know what it is.
Steve?
Well, I mean, for me, the most upsetting thing is, well, two things. One is the delay. So the MHRA approved the safety for 12s and over in June, 4th of June, I think it was. That gave us a window to act prior to schools going back. And many countries did, as Bharat's just rightly pointed out. So I have to question why it took 4 months, and why also we haven't seen that analysis published. And I completely agree with what Bharat's saying in terms of the inclusion of certain pieces of evidence for consideration that they should have done. And that's probably what made Chris Whitty and the other CMOs approve that in the end of the day. But I think, yes, we need the mitigations, of course we do. And the vaccinations are a huge part of this. And you can see that in the UK now by comparing older teenagers with younger teenagers. And part of the consequences of the success of our vaccination program that we've had this year is that we've skewed the epidemic down into younger people. And so obviously the greatest increases in cases have been amongst children at school. And since they've been back, it's demonstrably exploded in, especially under 16s. That is a huge route of infection. It's, of course, by having such a huge denominator, meaning that the relatively smaller risk for young children to get ill means that it's happening more often. And we're seeing this in hospitalizations and sadly deaths. And, that is just unacceptable. And it's such a simple thing to do. And it's also quite tragic that since it was approved for 12 and over, it hasn't been approved in a meaningful regimen. It's a single dose. I'm hoping they will approve the second dose, as they did do for 16s and over. And it's taking a hell of a long time. Yeah. And I think that may be because we've got also the booster program coming on, which is operating at more of a sensible capacity. They're also vaccinating frontline NHS staff. I appreciate that. Of course, these are priorities. But at the end of the day, what drives the need for boosters, what drives the need to protect children is prevalence. And so it's a complete chicken and egg scenario here, because we went from a situation where we were completely in control over summer in May and June to opening up. The prevalence is what's driving all these terrible things that we keep seeing. And the vaccines are a brilliant way of combating that, but they cannot do it on their own. And we've seen that in places like Singapore, where they've got an incredibly high vaccination rate. They've let everything go again, and it's too soon. When you're looking and talking about either endemicity or having herd immunity, all these concepts, they start from a low level of infections. They don't start from 40, 50,000 cases every day. And it's quite depressing to see that people are saying that the peak is over with, when it's clearly to do with half term. It started ticking back up again. And there are numerous people on social media that have been saying, that's it. We've reached herd immunity again. I think it's about the 16th time we've hit herd immunity, and the it's going to go back up because the children are mixing again, and we're nowhere near herd immunity.
Yeah.
So it's really sad. And just look at the older teenagers and how well they're being protected. Please afford that protection to younger children as well.
Yeah. I mean, herd immunity, I guess, I mean, you're the virologist, not me, but of course, when these variants come around as well, surely if you've built up herd immunity to, say, the Alpha strain, and then along comes the Delta strain, herd immunity has to start again to an extent. Am I right in that thinking?
No, not really.
No, it's dynamic. I mean, sorry, Barrett, do you want to?
No, carry on.
No, okay, it's dynamic. So, herd immunity is defined as if a new outbreak were to occur, then our level of immunity would be such that the R value, so what reflects whether the epidemic will increase or decrease, so above 1 or below 1, is lower than 1. So that inherent protection that we all have, because we have ongoing outbreaks and epidemic growth and exponential growth and huge amounts of prevalence, even if you reach that threshold, there's always going to be a proportion of your population that's susceptible. So you always get an overspill. So it's actually really hard to tell if we've reached herd immunity whilst we still have really high prevalence. We would actually literally have to start, if we in June sent all the school kids back and nothing had happened, then you could have possibly said, this looks like it could be promising. But as it stands now, we are still seeing exponential growth. Whether or not we've reached any kind of herd immunity threshold, it's relative and it's dynamic. As immunity wanes and as variants change and as we vaccinate more people, but R does not have to be kept below 1 by just vaccines. And I think this is where our UK policy is really falling down, because even just minimal mitigations could help bring that down. They're saying it's around 0.9 at the moment, probably based on a couple of weeks back, probably based on half-term effects, right? Because of course the spread is largely being driven in kids. You can see in Scotland now that the cases are pretty flat overall. That's because cases have come down in older people because they've not been catching it from the kids because they were at half-term. They've now gone back. Younger cases are going back up again, and I predict that will almost certainly happen again in England and elsewhere in the UK. So it's maddening to see this discussion of herd immunity from really an ill-informed concept, I'm afraid.
I mean, it's frustrating, especially for you guys from SOFED as well, as I'm sure we speak on this program virtually every time we meet up, that schools are the drivers of this pandemic. They are some of the most densely populated parts of our communities, with so many people in such a small space, and of all ages, of course. And of course, the vast majority of these individuals for so long were not being vaccinated at all. And it seems that the government has been dragged kicking and screaming to, well, we'll come down to 17 or we'll come down to 12. And it just seems like we're pulling teeth with them all the time. All the evidence over the last 18 months, coming up on 2 years now, that schools have driven this infection because of the sheer number of people in them. And every time, of course, there's been a school holiday, a half term, and we've seen those figures dip. And then as soon as the children go back, they've gone back up again. Why is the government's response now to triple lock schools into stopping them from being able to shut, despite all mitigations from mask wearing to social distancing to bubbles, all going? I mean, it just seems to defy logic to my mind. What do you guys think?
Said from the very beginning that schools could have remained open, in-person education can remain safe and sustainable and fair to all as long as mitigations were in place. Nobody wanted, well, none of us at SafeEd, the Hive, fighting for vulnerable lives, hazards, everyone with our collective, none of us wanted schools to close. All of us recognised when they closed in March 2020, it was brand new, there was a scrabbling around, not sure what to do, close them, remote educate, nothing was done in a timely fashion, nothing was planned. Somewhere there will have been infectious disease control plans, and there should have been this is what happens in this case. I don't think it was used, or I think there's been people in other countries say they used the UK plan that we then didn't use. Anyway, as I said, I'm not an expert, I'm just a mum. But I knew from the beginning with an asthmatic child who at that time was about to go into secondary school in September, I knew I was not comfortable in going from being at home, seeing very few people, keeping our distance, wearing masks, being sensible, to him being shoved in a classroom with 30 other kids for 6 hours a day with nothing in place. So I know I came at it originally from, I want to protect both my children. I'm not negating my older one, but I came from the fact that he's got asthma. He suffers when he gets a cold. He's had to be blue lighted and taken to hospital. He doesn't want that. So what can I do? So when I started looking into the fact that there was going to be nothing in place, and when I started questioning why, and I was getting ridiculous answers from the school, but also from everybody else, my MP, everybody, it's all right, they'll be fine. My MP told me there's mitigations in schools. And I was like, right, like what? And she said, well, there's bubbles. I said, yeah, his bubble is 300, his whole school year group. And she was shocked. So she didn't know the facts. She wasn't asking the questions. So even from not being in the medical profession or any expert, we knew this was not right. We knew that it didn't make sense. And then when you started looking at what was everywhere else happening, you know, children from age 6 with maths, remote learning, options of blended learning, protection for the vulnerable children to be able to have some kind of social interaction and remote education at the same time. There are all these things, best practice around the world, and it didn't happen here. And I still don't understand why it didn't happen here, unless the whole point was to infect as many young people as possible, as quickly as possible. That's the only thing I'm left with.
Well, Sarah, I think it is very different now in some respects, in the sense that we have, you know, like you say, schools were closed last year. A lot of the analysis was done in a system that wasn't actually representative of what a normal school pattern of behaviour would be. Last autumn, when we went back, I think perhaps juvenile cases were less prevalent amongst the population because we had so many more susceptible people amongst the rest of the population, and we were still seeing lots of infection in young adults, adolescents, students, and what have you, that were all going back and mixing after things like Eat Out to Help Out and all that sort of stuff, craziness. Now we have this perfect storm. We have the fact that the majority of older adults and older teenagers are now vaccinated. We have the fact that Delta is far more infectious than Alpha even, and the original Chinese strain, sorry, not the Chinese strain, the strain first identified in China, was, and this is a major issue. And also at the beginning of 2020, we didn't really understand how aerosolized this virus was and how transmissible it was. And it maybe Delta is more aerosolizable. And we were basing it primarily on the original SARS, and SARS was much more droplet spread, and you could wash your hands and deal with that a lot of the time, not all the time. So that's where that original mantra came from, and I found myself saying the same thing. But now Delta, it really is a game changer, and the problem is we haven't changed our game plan. So, you know, ever since spring, when Delta was allowed in through our leaky borders, you know, we've not been able to contain this thing. They tried to contain it in the Northwest, in different towns, in different parts of the country. You cannot do that if you're going to allow movement. And that's what's happened, you know. And so we have, it's about your susceptible population, and our susceptible population at the moment are young children because they've not been vaccinated, and people in whose immunity is waning as the vaccines are going down. And that's a crying shame. And of course, the main issue that we all detest about this policy to allow prevalence and to say that cases don't matter, which of course is rubbish, is that those people who are clinically vulnerable are exposed and long COVID is left unchecked. So that for me is just all three of those things: children, long COVID, and clinically vulnerable people are the victims of the current policy, and I think it's unacceptable.
Yeah, unacceptable and craziness. Just we're going to come back to a point you made a few moments ago, Stephen, and that's the as much as we said about young people finally getting vaccinations, for many of them, they're only getting one shot of a two-part vaccine. I have struggled, you're shaking your head already, so I think you know what's coming. I have struggled to find any scientific evidence or basis for this. I don't know if you knew who came up with this bright idea, but I don't know of any scientific evidence to back up only giving young people half a vaccine.
I think what's happened there, Damien, is they know that they've allowed an infection to go through the school's population. So they're now surmising that the one vaccine, so it's one wild infection, one vaccine may be enough. And I wonder if that is their supposition for advocating just the one vaccine, because there is definitely something wrong that we've done here, which is we've allowed an infection to go through the school's population, and we will be immunizing many children who've already encountered the virus. And I wonder that. The other thing, which is of great concern, is how are these people coming to their analysis that they say because of potential myocarditis in young children, especially boys, we will take the precautionary principle of giving to them just the one vaccine. Now, we do know that if you get wild infection, you're more likely to get myocarditis, which takes a lot longer to get better from, compared to the rare event when you may get myocarditis due to the vaccine, from which the duration of your myocarditis is short-lived. So to use myocarditis as a reason for not immunizing or partially immunizing, I don't know how you're making these decisions.
Yeah, it's and of course anybody who's of an anti-vax persuasion has seized on the myocarditis side of things and has actually twisted it and made the implication that the virus is the vaccine even is you're far more likely to cause myocarditis in children, when actually it's quite the opposite. We've spoken, we've had guests on before, and we've discussed what happens when, in how variants spring up and arise. And one of the ways that variants, I'm led to believe, do arise is when viruses are put under pressure to change. Surely only giving half a vaccine course, this one shot, is this not putting the virus under pressure? Is this not encouraging it to change?
Well, it's the type of pressure, Damien. It's the type of pressure. So, I mean, just very briefly coming back to Bharat's point, I completely agree. You know, they're trying to reduce the risk of myocarditis on the one hand, but if you're doing a risk-benefit analysis, you're also doing away with the second jab, the thing that gives you the most benefit. Okay.
Yes.
So I don't understand that at all. And you're right, there hasn't been, as far as I know, a trial looking at a single shot for children, because all of those trials have been with RNA vaccines. They've not done it with the Janssen, as far as I know, which is the only single shot vaccine I know of. But coming back to your point, yes, two things drive the evolution of the virus. One is it's wanting to get better at infecting us because it's just jumped over from bats a couple of years ago-ish. And that happens. And we saw that sort of thing with increased transmissibility and things like the alpha variant. There are also pressures that by and large have been driven through natural responses to infection, our own innate, our own immune responses, because before we had highly vaccinated countries, most people were making natural immune responses. And so things like the beta and the gamma variant are far better at eluding the sorts of immune responses that are induced through natural immunity. Now what we have is highly vaccinated populations, but they're only partially vaccinated. So it is almost like an assault course for the virus. Now, I'm not saying this will necessarily happen, and variants don't happen overnight. It happens through an accumulation of changes in that virus, okay? But what you have if you have lots of infections and you have partially vaccinated pools is that virus is able to make changes, which is an entirely random process, and try them out, and then still have a sort of safe harbor, if you like, of people where it can continue to thrive. And so by doing that, you may, and we are seeing changes in the evolution of the Delta variant at the moment, not too concerning, but they're certainly not suggesting that it's reached its peak of evolution, which some people were saying not long ago. This thing is still changing, and it's going to change because we're changing its environment. So yes, you're absolutely right. By setting it sort of the Krypton factor assault course of having partially vaccinated children and waning immunity in adults, but also then no barriers to its transmission in terms of susceptible people mixing indoors and things like that. It really is what you would call a crucible for sort of mixing these sorts of things. You can't say for sure it's going to happen. And the vaccines do give demonstrably higher protective levels, especially the third and possibly even fourth doses in normally immunocompetent people. So you can make up for that sort of evasive behavior that the virus has by increasing the levels of protective antibody and the vigorousness of your T cells, for example. But it's not a good idea, frankly, if you want to future-proof. And unless we want to get into this cycle, as we have with influenza, of constantly having to update vaccines and giving it every year, which people seem to think is just going to be quite straightforward, which if you look at the vaccine rollout at the moment, I cannot agree, okay? That is a cycle I don't think we need to get into with this virus. I don't think it behaves like influenza in that way. There are demonstrable differences between this virus and influenza. We don't know that we can adopt an influenza type strategy with this virus, and yet it seems to be what they're going for. And I frankly feel that's a profound mistake.
Yes.
Can I ask a quick question of you both? Quite often I have anti-vax people or COVID minimizers tell me that the virus is going to mutate. Yes, it's going to keep mutating, but it'll mutate to where it's not a threat to us at all. It will become less problematic to us, to our human system.
Do you want to take this, Barrett, or shall I? I mean,
go ahead.
Yeah, that's complete myth, right? When a disease becomes, set at some kind of endemic set point, which means that the number of people that are susceptible to being infected and the infectivity of the virus are in balance, so that R is basically 1. So it stays steady, apart from the occasional outbreak where your immunity drops. So a good example of that is measles. So the idiots that believe Wakefield 20 odd years ago and didn't vaccinate their kids have now led to outbreaks at universities and music concerts of measles and mumps. Okay, not so much rubella, weird, but so this is a problem because the virus there isn't changing as well. Measles, we have a really good vaccine in measles, and we've been able to use the same vaccine since the 1960s-ish, okay, because that virus doesn't have the flexibility in the surface proteins on the particle to change. SARS-CoV-2 does seem to. It seems to have an incredible capacity not to be hypervariable and change all over the place like something like hepatitis C or HIV or flu, but to change in a subtle way that it can just adapt to all these changes really well and tolerate them and completely outdo some of our immune responses and increase its ability to infect cells, okay? So I predict, well, what happens is when a virus becomes less of a clinical problem in a population, it's because our immunity has increased. And the problem is with SARS-CoV-2 is that's going to be dynamic. And so we have to be dynamic, which is why we're in danger of entering this race of an influenza type strategy, which is a race I don't know if we know we can win. So it's not going to be something that just fades away into nothing. If it does become that through natural acquired immunity, it will take years in the same way that some of the endogenous, the seasonal coronaviruses have become. But the harm endured along that road needn't be as bad as it is looking like it's going to be, because we should vaccinate everybody and we could control this virus as we have done in the last 2 summers.
Yeah, I guess another obstacle in your Krypton factor obstacle course is the fact that in secondary schools, certainly you have, I know Nikki particularly this affects, is that amongst year 7, for example, you have a population of 12-year-olds and a population of 11-year-olds. And of course, only the 12-year-olds are currently accessing the vaccine. And of course, in primary schools, they're not being vaccinated at all. Yet we're seeing in other parts of the world, the rollout of vaccines in the age group of 5 to 11, but we're not seeing it here. What we are seeing is reports of classes in primary schools where half the class is testing positive, but the class remains open for everyone else. The Education Minister, Nadhim Zahawi, says they aren't necessary here. So why are other parts of the world doing it? What does the data, what does the research say about vaccinating this age group?
Well, they're very immunogenic, right? So the vaccines are very effective in that age group. And United States is going to start, if it hasn't already, immunizing the younger age group. Now, to develop that same theme that Steve was talking about suppressing infections, if you immunize extensively across many, many age groups, in fact, all age groups, what you can end up having is suppression of infections across the board. And when you have suppression of infection across the board, you generate fewer cases altogether. And therefore, it is a thing to do. It is immunogenic, it works. And even if the little children are not going to have severe illness, it doesn't mean you don't suppress it.
Definitely. And of course, for the virus to change, it has to have the opportunity to change. And for the opportunity to change, it has to replicate in a pair of lungs.
Correct.
We can't pick which pair of lungs that virus replicates in unless it's a vaccinated pair of lungs, and which makes it far less likely. There's a lot of very worrying rhetoric around on social media, and has been on some media channels at the moment, that the vaccines do not prevent infection and they don't prevent onward transmission. They don't 100% prevent it, no. But whether you're infected with the virus is a consequence of your immune protection and your circumstances and the environment around you, but also your exposure, okay? So you have a risk reduction by being immune through a vaccine, or indeed through natural immunity. That varies from different people because we're genetically diverse and we've responded to those circumstances differently. Think about it like you've got a raincoat on and you go out in a light shower, you're not going to get wet. If you stand out in a thunderstorm for 6 hours, you will get wet, okay? The level of protection goes down over time because you just can't physically keep making those antibodies all the time. Your immune system would be exhausted. So you need to keep boosting if you want those levels. And we don't make so much of the antibodies that sort of stay in the airway and the tissues, these IgA, these mucosal antibodies, but we make enough of the stuff that goes around in our blood so that they do get into the tissues in the lung and does protect us. And also, even though we know that Delta can transmit from vaccinated people when they're infected through a breakthrough, it's still less likely. And so this is what we call the secondary attack rate, is reduced if you're infected to pass it on to somebody else. And yes, there are instances which can be reported in the paper of double vaccinated person gives virus to double vaccinated person. That can happen, but as a population, it comes down. And that's the point. And if they insist on saying the vaccines aren't working, they only protect individuals. I've noticed it's a line that certain people are taking about not vaccinating NHS staff at the moment. I've had it because I've done work with care home staff, trying to persuade them that it's the right thing to do. They say we're not protecting our clients, we're not protecting our patients. That is deeply flawed, and it's something that's being pushed by certain groups that are essentially anti-vaccine and have no business doing that.
Well, when you say it's pushed by certain groups, we've all seen the heart leaked chats, and it was specifically stated in there. I can't remember whether it was Michael Yaden or someone, that we needed to sow the seed that vaccination does not protect you and does not stop transmission. We need to sow the seeds that vaccinations can actually make you transmit from having a vaccine. And we have to make sure that parents think they might be harming their children if they ask for a vaccine. Those three things are in those chat logs. So there's, the germ of the idea started and carried on and continues all over.
Claire Craig said that very thing today on GB News.
Can Can I ask you both one question for personal reasons, but also because I've been asked about 75 times today? Do you think the UK will go down the route of vaccinating younger children, or do you think the JCVI are going to block it?
No, I hope they will. That's my sincere hope and wish. And I hope that they won't make the same mistake with they did with the school children. So I hope so. And look, there are independent reports which clearly say JCVI did not take enough advice from other international experts. I hope this time they will.
Because I think there's also a lot of concern is that there's been radio silence. You know, we've heard from America and Australia and all these other countries, the EMA, who are looking at it, but no announcement from the UK. Do you think that means they're not doing it, or they're just keeping a lid on things?
Oh no, they will be assessing it. I'm sure MHRA almost certainly will be. And I guess, you know, hopefully there won't be too long a delay, but the more delay there is, which is another argument that I couldn't quite understand for the delay previously, during that interim period, millions of children were vaccinated in different countries in the US and Israel. And that is real world data. And so no matter which studies were being assessed, and it is important to look at controlled studies, but there's such a huge amount of real world data there. That the weight of evidence is overwhelming in my view that it's favorable. And so the weight of evidence against it being directly harmful is also overwhelming. So, you know, of course, all medicines have risks. There's always going to be a small number of people who sadly have an extreme reaction to a vaccine. But again, that's mainly because we are genetically diverse and we don't all respond to a vaccine or indeed an infection in the same way. So you can't just say that this vaccine's working like a pill and you take it and it happens. It's an interaction between our immune systems and the vaccine, which is stimulating the same response it would make to the virus, but without the unfortunate aspect of being infected with SARS coronavirus 2. Let's remember SARS stands for Severe Acute Respiratory Syndrome, not COVID.
No, indeed. One thing I wanted to, put to all of you, actually. So the news story that's came up in the local news to me this week, and it sort of relates to how schools are choosing to enforce the instructions they're being given, because obviously things have changed. We had mitigations at one point. They've been lifted in an awful lot of cases, sadly. And I've basically, some schools take a particularly hardline stance regarding children being taken out of school, particularly by parents who are vulnerable. Some get the local authorities involved, threaten parents with fines, social services. But one story that near me, a school in Camborne in Cornwall has told a mother of two daughters, one of whom has just tested positive, that she cannot keep the child that has so far not tested positive at home, but that they must be sent to school. Now, Mum has tried reasoning with them to no avail. Mum works at the Royal Cornwall Hospital in Truro. As much as we can take the government to task over its failings, schools, having been dealing with this for some time, should surely know better by now. What happened to duty of care during this pandemic, and what do you make of attitudes like that from a school?
Can I just put in and say and explain? It happened to me. So when my youngest, after 5 days returning in September, remember he's asthmatic, when he contracted COVID, I decided that our household would isolate for 10 days. Apart from the fact that we were dealing with him, he was very ill. We kept him out of hospital. Thank you to his asthma nurse. That's fantastic. However, I kept my eldest son home. I informed the school. I had informed the school prior to school starting that I would not send either of my children in if either myself, my husband, or any of them contracted COVID. I'd already told them in writing and thought it was sensible. So when it happened, I told them my eldest would not be going to school and could he have access to the remote learning. He was told no, because that's only for people who are infected. So I was like, so if you infected him, but he's well enough to work, he can have access to the remote learning. But because he's not sick, he's not allowed access to remote learning. But you're saying it's all about his education, so I should send him in. But I'm saying, well, if it's all about his education, I'm not sending him in. Anyway, as you all, some of you know, it went on from there, what resulted in my son then being given a red card for not being allowed to attend the prom because his attendance he missed 8 days of school because of the 10-day, how it fell, which is still having repercussions now. He's been told, at the start of his final year, he got a red card given to him in an envelope that said prom with it crossed out. So he's not allowed to attend the prom. And as I said, it was my decision to keep him home. I'm the one that if you want to punish anyone, you should be punishing, not him. Which obviously you can imagine the repercussions with a 15-year-old is, this is all your fault, you've ruined my life, all those kind of things. So I've been on the receiving end of schools who are totally inflexible. It doesn't matter if someone in your household has tested positive or is symptomatic and is very ill. At the time, his brother was very ill. He was supposed to take a PCR, which we all did. He was negative. We all were, apart from Ollie. And he was told he was supposed to attend school then. He was actually supposed to attend school while waiting for the results of the PCR, which to me just made no sense whatsoever. Anyway, so it does happen. I've been on the receiving end of it, and I'd like to hear from both of you. What do you think of that policy?
Well, this is the sort of thing that makes my life difficult as an infectious disease control expert, in that I can't properly subdue and suppress and control infections in the schools setting. And I'm old enough and experienced enough to be able to say, don't blame me if this doesn't come under control. I'm trying my best, but I can't do all that I would like to do. But many of my colleagues wouldn't be able to say that, right? But that is what it is. You are handicapping me from doing my job properly to suppress infections in the school.
Yeah, absolutely. I mean, there are so many things wrong with this, and it's easy to target the schools, and of course they have the right to carry out these things or act independently. They can take it up with the local authority, as far as I know. But I can understand the pressures that they might be under as well. So I think we have to recognise that this has got its root in UK policy. For example, the dismantlement of the bubbles, which weren't fit for purpose, but just because something isn't working properly, you don't just get rid of it. That's the same mentality as turning down the NHS app, right? Because there's a pandemic, isn't that annoying? No, deal with the cause, right? So now we have no bubbles, it's left to NHS test and trace, and therefore it's under UK guidance. And UK guidance currently says that you are exempted from isolating if you are double vaccinated and had close contact or under 18. Now, what other disease is there, Barrett, you might know, that there has ever been an exemption from isolating because of your age? I have never come across that, and it's mad, right? It's mad. It's the same mentality of just letting everything go and getting back to, liberation or whatever you like, that has landed us in 3 lockdowns already, because no one is prepared to just take a sensible middle road and say, let's sort this out. We don't need to be as draconian about this, that, and this. We understand how to do this now. But they've not done that either. If you look at schools in Europe and America, they've been investing in ventilation.
Yes.
They still wear masks. They wear protective masks as well, much of the time. They have lots of good infection control in terms of quarantine and isolation and testing. These rules, I'm afraid, I have to say, about the isolating, about the criterion when you get tested and all the rest of it. And let's remember, tests only catch a certain window in people, especially if they're vaccinated, because your virus load is quite transient. If you've been vaccinated a lot of the time, you don't always catch them. So it's much, much better to isolate households in the same way that you've done, Sarah, and stop infections. And the last thing I would say is, what has changed since a few months ago? It's the same virus, it's the same children. In fact, the virus is worse, actually. Delta is nasty and should not be underestimated. And yet, we were keeping our children isolated and closing schools last spring, and we're not now. So I find that reproachable, even if the chances relative to adults is that they're lower of having severe disease, it's still a chance. And with the denominator we're talking about, which is tens of thousands of children every day, we are seeing disease. We're seeing 1,000 hospitalizations roughly every month in under 18s. We are seeing deaths, and we are seeing long COVID, and that is just unacceptable. And of course, The irony being, much like the lockdown situation, is that disruption is becoming ridiculous because of the cases, because there comes to a point where someone does have to intervene and shut the class and shut the school. So just sort it out, please. It's a joke.
Yeah. It does feel like things have gone completely backwards now, doesn't it? The mitigations in schools removed. So much emphasis is being placed on the vaccines. I've lost count of the many depressing conversations I've had with certain family members, generally of a certain age, although I'm not exclusively bagging a certain demographic at all, saying, because they're going maskless, saying, well, I've had the vaccine and we're fine now. But you've only got to look at the daily stats every day to see cases rising, hospitalizations rising, deaths rising. It seems clear to me now that with vaccine boosters now being rolled out, the vaccines on their own, even though those boosters are being rolled out, are not enough. Are we ever going to get out of this pandemic the way things are going? And if not, what do we need to see happening now for that to happen? What message to the government would you have?
Hold on, Damien, before we go into that subject, I wanted to add that Germany started its mitigations in schools a year ago. It grasped the nettle. So it grasped the nettle of space, ventilation, all the mitigations that we've talked about. And Gavin Williamson was Secretary of State for Education in this country at that time. And there was absolute inertia on that subject. And I recall asking, what are we doing about it? And it was nothing. I feel our ministers in responsible positions, disconnected with reality and life, do they send their children to some other fancy private school where there are fewer pupils and lots of distance learning and they're racing ahead? Whereas children, majority of children in state schools, old schools, where there has been underinvestment for decades upon decades, the problem was so big to address that they thought it's not worth addressing at all. So sorry, it really must be added on record. You know, I had to say what I said. No. So in answer to your question, what should we do? This is not super rocket science at all. So this is a human-to-human spread of infection. This is mostly aerosol spread of infection. And because it is mostly aerosol and a human spread of infection, you bring in your mitigations. Your mitigations cannot ever be singular. So this idea of you're not taking your boosters, you're at fault is wrong, right? Your mitigations have to be several and across the board. Immunize across all age groups. Wear your mask properly. Specify higher quality mask. I changed since Delta arrived. I changed to FFP2 masks because they do a better job. That advice, when I give to nursing homes, is met with computer says no, meaning the CCG tell me that guidelines say nothing about FFP2 masks, we can't do this. And I say, gosh, you're being awkward because we know this works better. We know that this can be cost effective, but you're giving me computer says no answer. So what are the mitigations? We need to speed up with lousy guidelines, which have been watered down by the previous PHE, now UK Health Security Agency on the matters PPE. Secondly, we need to immunize. Third is simple measures, the 3 C's, which the Japanese have deployed very cleverly. The 3 C's. Avoid getting close to people, avoid crowds, avoid closed indoor spaces. In other words, ventilate. Listen, ventilation isn't about there is too many people in this room, therefore ventilate. It is about there is this invisible plume of virus particles in the air. You could enter a previously occupied room with very few people in today, right now, but previously occupied 20 minutes ago, say half an hour, 2 hours ago, that lousy plume is still waiting to catch you, right? And then to say that because I'm 2 meters away, I'm okay, is nonsense, because the plume will travel many, many, many meters It doesn't sort of say, I stopped traveling after 2 meters. It's aerosolized. If it was droplet spread, then you could say that droplet plume after 2 meters becomes innocuous. Yeah, it's not laden with virus particles. Steve knows a lot more about this. I'll let Steve add to it.
Yeah, I completely agree, Bharat. The mitigations are very clear. Colleagues of mine, I've been a small part of a paper recently that's advising on safe returns to universities, and it's saying this exact same thing. It's really simple, and never mind summer 21, we've had since summer 20 to deal with this, right?
Yes.
And the fact is that if you look across Europe, and yes, there are now issues with Delta coming up in different countries, but again, mainly because they relaxed. But had we prevented our infections in schools over the summer, it would not have driven such a huge increase of cases after the initial July peak from Freedom Day, whatever. The children have been driving this. You stop that, it then reduces the prevalence. It reduces the need to roll your boosters out so quickly.
Yes.
Reduces the number of people that are being found by the virus that's being spread by the children, who then are more likely to end up in hospital and get sick. And that's people whose immunity is waning, people who are older and perhaps more vulnerable, irrespective of vaccines, and people who haven't had their vaccines, and there are a considerable number of people, several million people in the people that have been offered a vaccine that haven't taken that up. And I really hope the people that have been trying to fight against having vaccines are conscious of this, because many of these people are in hospital and very unwell, and some of them are dying. And what really irks me, and irks is a complete trivialization, is that this is a vaccine preventable disease, right? And we are currently seeing cases, pretty high, but hospitalizations are still 20 to 30% of what they were in the January peak. The deaths are around 10% of what the January peak was. The January peak was pretty short-lived. This surge is a completely different epidemic shape. It's a gradual increase. It has waves, it has undulations, but it's been consistently high since July. And that translates into harm, morbidity, and pressure on our NHS. And our NHS staff, as I'm sure Bharat will be able to tell you, are at their wits' end with all of this. We're getting A&Es backed up. We're getting everything backed up because critical care is backed up. About a third of patients are currently in most hospitals COVID patients, but that has knock-on effects for the way the rest of the ICU behaves. It's a disaster, and it's going to get worse because we will see flu, and we will have an increased number of cases from COVID. There is still RSV, adenovirus, and rhinovirus floating around the community causing ill harm. There are all sorts of viruses I won't name because people here won't know what they are, but the sorts of respiratory viruses that we see every winter and do cause problems are going to be exacerbating this problem. And even if it doesn't turn out to be as bad as the flu this winter, there's something you can do about the COVID problem by vaccinating and mitigating. We know that. So why wouldn't you?
Exactly. I hope those in power are listening. We are at the end of our time. We're at the end of our time.
One little one, please. One little one. I was just going to say that I was really encouraged recently that we seem to have had some government messaging about ventilation and the importance of ventilation.
Yes.
And, the radio today, just as I was driving back before this, the virus is spread. 1 in 3 people don't know that they have the virus, and they're breathing out particles. And the advice is to open a window every now and again if you're meeting indoors with people. Is that sensible advice? Does it need to go further? That's all I wanted to know. And I was thinking, we're sort of getting there in small steps by them talking about ventilation and talking about it being aerosol and people breathing out and whatever. But I felt that sort of then negated what they just said by saying, yeah, all you have to do is open a window every now and again.
Periodically opening the window is a smokescreen. You always got to do multiple layers of infection control measures, and every now and then open your window is not good enough. It just is not good enough. It'll take too long to explain why it's not so good enough.
Yeah,
we are
every little helps, but I think we have people like Trish Greenall and Kath Noakes to thank for that message coming through, which is fantastic. But as Barrett says, it's not enough. You know, we need multiple air changes in rooms. It's not enough. It really isn't. But if it's really bad, you can invest in HEPA filters to help. Please do that.
Brilliant. Thank you very much for your time, everyone, tonight. Thank you very much to SafeEd. Thank you very much to the Hive. Thank you ever so much for your valuable time tonight. Doctors Barrett Pankania and Dr. Steve Griffin, you have been absolutely fantastic contributors tonight. I hope you will consider coming back again at another time.
Thank you.
In the meantime, we will see you all once more next week on the next SafeEd show. Good night.